Hi, I'm Dr. Julie Steinauer. Well, tonight I have a bit of a serious topic that I want to talk to you about, which is double vision and when it suddenly seems to come on all of a sudden, just like you wake up from it and all of a sudden there it is, double vision. Now, what do you do? Before we go into talking about this topic, let's talk about how you can connect with our clinic. You can call us at 618-288-1489. Or if you want more information and you're not local, you can go to our website at visionforlifeworks.com. You have two options here. One is to fill out a questionnaire and answer some generalized questions about your vision. Please realize this is not going to get specific in asking you, do you have nystagmus? Do you have amblyopia? It is meant to be a generalized approach to learning more about your vision and how it might be impacting you. You will get some feedback, but again, if you're looking for something highly specific, that's when you need to schedule a consultation. The consultation one-on-one, online, or scheduling an appointment in our clinic face-to-face is the only way to truly get more in-depth information about your individualized needs. Now, let's go back and talk about this double vision that crops up all of a sudden. Of course, there are several things that you want to be concerned about if you suddenly have an onset of double vision. One is, have you had some sort of traumatic brain injury? If you haven't had that more recently, have you had a stroke? Do you have, maybe even something more serious going on with lots of headaches that would indicate that there's possibly a tumor or something that could be occurring inside of your brain? Now, obviously, we hope that's never the case for anyone, but on some occasions it does happen. And we want you to be aware that if you have an onset of a kind of quick onset of double vision, this always warrants you going to your general physician first, being checked out and looked over, and then probably ordering an MRI to be able to scan and see what's going on inside of the brain. We want to make sure that your life is not threatened by anything super serious. Once we've established that there's nothing like that, there are other things to look at. Again, did you have a stroke? That would be something that would be picked up on testing. Do you have something like MS? And that is something that we see occurring a little bit more frequently these days in patients than what we have noticed in the past, is that some patients are finding out that they have some symptoms of MS and then receiving a diagnosis based on the scan seeing plaques within the brain. Now, if that's you, you have to know that there are a lot of different ways that MS can be managed, and you can have a better outcome than just allowing it to progress further and further by really doing research and kind of getting some help more quickly. That might involve supplements, it might involve changing your diet, it might involve getting on certain medications. There are quite a few things that can be done. But if you're experiencing double vision as a result of MS, we want you to know that there's hope for you and it can be treated and it can get better. Generally, this is occurring because something has happened to the way that, something has occurred to the muscles that are attached around the eyes and are helping the eyes to be in alignment with each other. And so if this misalignment occurs and the muscles are affected, then we'll tend to see some form of strabismus that develops. Many patients with MS will develop an eye crossing type of misalignment of the eyes, and this is fairly common. Now, if this is you and you've recently been diagnosed and started to have some problems with vision, or maybe you're long-standing with MS and you've had problems with your vision, there are things that can help you. We do utilize Syntonics, which I talk about all the time in my office. Different classes are designed to do different things to train the brain and the muscles around the eyes what to do. So we can use Syntonics to electrically trigger the brain to align and use the two eyes better together as a team. So even someone who has MS can benefit from a Centonics and vision therapy program. If this is you and you have questions regarding what's going on with your vision and how we might be able to help, if you're local, call us at 618-288-1489. If you're not local, you can go to our website at visionforlifeworks.com. I would probably guide you towards scheduling a consultation at that, as that is definitely a more direct approach to finding out more about your vision. But if you just want to kind of place the toes and dip them into the water a little bit, then feel free to get started by filling out a questionnaire. The questionnaire is again designed to be somewhat general or generic information that we're gathering from you to see if you need help with anything visually. And the consultation is meant to be very specific and guided and direct in what exactly can be done to help you. During that consultation, we are going to talk about your visual condition, how it's affecting you, what we can do to treat it. Can we correct it fully? Can we just improve it? What does that look like? What do the 2 phases of our treatment program look like? How you can expect everything to go. Also, we're going to discuss over any kind of glasses prescription or medical results that you may have, or visual results from other doctors as well. Or if you're doing that in our clinic, we're going to be doing that in consultation and evaluation in our clinic. Now, if you like this video, hit the like button. If you haven't done so already, please subscribe to our channel, and make sure that you hit the all notification icon so that you get notified for all videos. And if you find out that this video, and truly feel that this video could help someone else who maybe is facing the diagnosis of MS, maybe it's new, maybe it's not new to them, then I'd ask that you please pass this on. It could be beneficial to them.